What's the possibility of a woman who is obviously in her reproductive phase of life achieving pregnancy when she meets with her partner during her bleeding? Now, for us to understand if it's possible, first of all, let's understand what happens in a normal situation. So how can you become pregnant on a normal level? What's the normal mechanism that will lead to pregnancy? So that's what I'm going to use this to illustrate. Now, first of all, for you to become pregnant, there are things you need to be conversant with. Number one, your cycle. So every woman has a cycle. Now, because a woman's cycle coincides with the months, so we normally use months to kind of evaluate cycle. So it's expected that a woman still in her reproductive phase of life will have about 2 to 7 days every month when she will bleed. Now, the normal range of bleeding in a woman within her reproductive phase of life is what? 2 to 7 days. 2 days is the lower limit of normal, and 7 days is the upper limit of normal. Now, for you to know your cycle, the very first day you bleed is the first day of your cycle. Now, if we use the example of September and October, assuming you bled on the 1st of September and you bled again on the 1st of October, for us to calculate your cycle, we count the number of days between the 1st of September to the 1st of October. So tentatively 30 days. So that particular woman will have 30 days menstrual cycle. Now, if every other factor that would determine if the woman is going to be pregnant is constant, a woman that has a 30-day cycle expectedly somewhere in the middle of her cycle will release her egg. Now, I want you to pay attention to two different phases in a woman's cycle. The first phase is what we call follicular phase. The second phase is the luteal phase. Now, of all the phases, tentatively, they are about equally distributed if we use a 28-day cycle as a constant. So a woman that has a 28-day cycle, half of 28 days is 14, right? Now, the first part of the cycle, it's called the follicular phase. Now, this follicular phase can fluctuate based on the regularity of that particular woman's cycle. The second phase, which is the luteal phase, is constant. Now, in a woman that has a 28-day cycle, which is what we normally use in teaching, what will lead to pregnancy? If the woman produces an egg, which expectedly will happen on day 14. So let's still use the example of a woman that started bleeding on the 1st of September. So it's expected that on the 14th of September, she will release her eggs. So this process of releasing the eggs from the ovaries is what ovulation is all about. Now, for this woman to become pregnant, if her partner meets with her within the period we call the fertility window, which is the best time the woman has a chance to become pregnant, she will become pregnant. Now, because the lifestyle of the sperm gives the sperm an opportunity to survive up to 7 days, but we normally use 5 days. If the partner meets with the woman 5 days before the ovulation, that means 5 days before day 14, which is on the 14th of September, she has a chance of becoming pregnant until the 16th of September. So tentatively and scientifically, this is the best time a woman can become pregnant if every other thing is constant. The period a woman can become pregnant is called the fertility window. Now, because there are so many factors that can change the woman's cycle, medical issues, body weight, tension, stress, disease, anxiety, heartache, spots, some women might have irregular period. Now, the question of if it's possible to become pregnant when you make love within your cycle, within your bleeding, it's yes and no. It's not common to have women becoming pregnant when they make with their partner when they are bleeding, because naturally, If you are bleeding, you will have at least 14 days before you ovulate. Now, the application of these 14 days is to women who have about an average of 28 to 30 days. So if everything in your body, the way God planned it, your hormones are working perfectly, and you're meeting with your partner, and we know that your cycle is 30 days or 20 days, you are not going to get pregnant during your bleeding. By all stretch and bounds, you cannot ovulate during your bleeding. Now, in some women who might have short cycle, so some women can have a cycle of about 20 to 24 days. Now, in such women, they will ovulate early. So a woman that has a 28 to 30 day cycle will ovulate on day 14 or day 16. But if you have a cycle of day 21 or 24, you are gonna ovulate early. So in that situation, if you make love during your bleeding, the possibility you will ovulate early is high. So the women that go out there and claim that they became pregnant when they made love during their bleeding did not become pregnant because they ovulated during the bleeding. They became pregnant because shortly after the bleeding, the sperm, which was deposited in the vagina, which can survive up to 7 days, got the egg that was released immediately fertilized. So some women who have short cycle can suddenly, immediately after their bleeding, release their egg. Now, remembering that the sperm can survive up to 7 days. So assuming an average woman can bleed for 5 days. Now, your partner meets you on the 3rd day of your bleeding. Your partner can deposit sperm in the vagina, which can go to the tubes. Remember, it can survive up to 7 days. So assuming you stop bleeding after 2 days, that sperm in the vagina can still meet with the egg that might be released immediately. So the answer is yes for women that might have short cycle, but no for women that have a normal, long, or regular cycle. So it's possible. The probability of becoming pregnant when you meet with your partner during your bleeding, it's there, but it's limited. It's only possible in some group of women who might have short cycle, in some women who might have irregular cycle. And this is the teaching in our group. Once you get to age 35, we don't preach ovulation sex. We don't preach fertility window sex. What do we preach? 48 hourly. Because a woman can become pregnant anytime in her cycle. But I want you to take home one point. The reason why some women became pregnant when they met with their partner during their bleeding is not because they ovulated during the bleeding. You cannot ovulate when you're bleeding. Remember the teaching. Remember the mechanism for bleeding. What leads to bleeding? If this eggs, which will be released from the ovary, it's been released, the cover of the womb is already getting ready to receive pregnancy. So every woman is structured to become pregnant every month. Now, when the cover of your womb, which is the endometrium, is being primed to receive the baby, when it doesn't happen, it will break down. So what women pass out during their bleeding is part of the tissues which was getting ready to receive the baby. So conventionally, you are not supposed to become pregnant if you have a regular cycle or a long cycle when you meet with your partner when you're bleeding. Now, I know some people will be wondering, but how can women make love when they are bleeding? That's where diversity can come in. What might work for you might not work for the other people. So some women prefer making love during their bleeding. Some women prefer making love after their bleeding. Some women prefer making love whenever they prefer making love. Some men prefer making love whenever they prefer making love. That's the beauty of diversity. So the fact you don't like it doesn't mean other people don't like it. What might work for you might not work for them. The most important thing is that the two parties agree. You see, when it comes to sexual intercourse, when it comes to sexuality, when it comes to what you love and what you don't love, it's your business. Whatever you do when you close your doors, that's you guys' choice. So if you feel comfortable making love during your bleeding and you have a short cycle, you can become pregnant. There are some people that can make love every day. There are some people that don't like making love. Love making is just like a task for them. Whatever works for you, please go and run with it. But if you want to have a baby, the general preaching in our group is what? 48 hourly lovemaking. The general teaching around 48 hourly lovemaking is to make sure that at any point in time you come to the vagina, you have some sperm. The reason is because once the eggs are released, the maximum an egg can survive is 48 hours, which is 2 days. Once that egg is denatured, it's dead, you have to start all over again. This is the reason why you don't have to practice ovulation sex, fertility window sex. Some women might think they are ovulating and they begin to time their sex. There are some women that just make love once in a month, but behold, you might be waiting for day 14 and it will happen on day 18. So once you miss your chance, you start all over again. For the 12 months in every year, you have at least one chance every month to become pregnant. Once you don't utilize that chance, you will lose the chance. So please, remember, there are some rarities in medical practice. So we don't use always or never. So next time someone asks you if it's possible to become pregnant during your bleeding, I want you to give that person a smart answer. Yes and no. Yes, for women that have a short cycle, irregular bleeding, probably getting old, probably have some medical conditions like women that have PCOS, they can ovulate anytime. Now, if you want to track if you are genuinely ovulating, you can get ovulation test kits out there. So you can check the spike in your LH. Your LH is the luteinizing hormone, which is the hormone we normally check. So before a woman ovulates, the luteinizing hormone will spike. That's called the LH surge. So shortly after the spike in your LH surge, you ovulate. Once a woman ovulates, this is where God is amazing. God structured women to do everything in time. Once a woman ovulates, if that egg is not used within 2 days, it's not going to be visible. But men can stay for 7 days. And men produce sperm every 3 months. But once a woman uses all her eggs, she has lost her chance of becoming pregnant naturally. Okay, so that's my presentation this evening. I'm going to open the floor so we can start asking our questions. So please, if you have any question in regards to this particular topic, please feel free and ask your questions. If today is the first day of attending our open clinic, my name is Dr. Trudy. I show up every Tuesday by this time, 7 p.m. Eastern Time, 12 a.m. in Nigerian time. Unfortunately, this is just about the time we have, and we know we are in different zones, but on Saturdays, we compensate. We come in a little bit early on Saturdays, which is your 5 p.m. Now, if you're not able to participate in real time, by the time you wake up, check out the links we've shared in social media, follow through, understand, and keep on keeping on. Keep on praying, keep on playing, and keep on practicing. Now, before you leave today, please make it a point of duty to click on the subscription button. When you're done, click on the notification so you don't miss any of our videos. So after today's broadcast, the next one is going to be on Saturday. Now, Saturday is going to be 5 p.m. Nigerian time, 12 p.m. Eastern Time, US. Now, the floor is open. Please go ahead and ask your questions so we can address your questions and we can go for the day. So please go ahead and ask your questions. Okay? If you have any questions in regards to this topic, the floor is open now. Please feel free and ask your questions. Make sure you understand the need for regular lovemaking. Make sure you understand how the egg behaves. Make sure you understand how the sperm behaves. So the first question says, does having heavy period indicate possible problems with fertility? The answer is yes. Now, when previously you are not a heavy bleeder, but suddenly you started bleeding heavily, it's possible you might have gynecological problems. And those gynecological problems can have fertility implications. Number one, you might have fibroid. Now, part of the presentation of fibroid is to distort your cycle. So depending on the location of the fibroid, depending on the size, and depending on the symptoms, The fibroid can disrupt your whole cycle. So from research, from experience, we notice that women that have fibroid tend to have heavy bleeding, painful bleeding, and bleeding in clots. So that heavy bleeding you started recently experiencing might be a sign you might have fibroid. Now, there are a couple of other conditions that can lead to heavy bleeding and painful bleeding. There are so many gynecological problems. It can be PCOS, it can be endometriosis, it can be adenomyosis, it can be so many of those causes there. So what I want you to do is to pay attention to your normality. The beautiful thing in women's health is to know the normal. So when you know the normal, when things are abnormal, you begin to know why. So one of the first things I will encourage you to do is to keep a track on your cycle. So what do I mean by that? Have a special app. You can pinpoint when you bleed. If you can pinpoint when you bleed, you can plot a graph of your cycle. Now, it's expected that at the extremes of ages, so when you have a daughter who recently started bleeding, if you pay attention, she will have irregular bleeding. Now, if you yourself is tending towards menopause, if you pay attention, you will notice irregularity. So between menopause and menarche, which is the first menses you will have, that's when you have stability. But when you're just starting, you can have irregularity. And when you're getting ready to go to menopause, you can have irregularity. So if you know how to plot, so assuming, let me give you an example. Some women might have regular 30-day cycle. Now, if suddenly your 30-day cycle is now 16 or 25 or 45, then we begin to worry. The normal regular cycle is 21 to 35 days. So if you used to have 30 days, then out of the 30 days when you're supposed to bleed, you haven't bled for 45 days, then we have a problem. What do you do when you have a problem? You begin to seek help from a gynecologist. Very important. Can you please explain fertility window? Very important concept in fertility. So you see, fertility window is actually a tentative window. Now, what are the components we use in defining the fertility window? The egg and the sperm. So we understood that the sperm, once deposited in the vagina, can survive up to 5 days. And we also understood that once the egg is released, it can survive up to 48 hours. So when we combine the longevity of the sperm and the longevity of the eggs, we arrived at a tentative 7 days. So this tentative 7 days is the so-called fertility window. So your fertility window is when you have the best chance, the best probability, the best opportunity, the best chance of becoming pregnant. Now, outside your fertility window, you can still become pregnant. So there is no never, there is no always. Now, your fertility window opens 5 days before you ovulate. Why is that 5 days important? Because that's the 5 days that the sperm can survive to get a woman pregnant. So when it opens on 5 days, it ends a day after ovulation. So if you count the 5 days and you count the ovulation day and you count a day after, you have 7 days. So tentatively, your fertility window is that period of 7 days when you have the best chance of becoming pregnant. Once you have gone outside your fertility window, you can still become pregnant, but your chances are reduced. Very important concept. Now, fertility window might not be applicable to women above 35 for the singular reason that when you get to 35, your fertility begins to dwindle. Your fertility window and your ovulation might work better if you're younger than 35. But we don't approach fertility clients that way. We encourage them to make love more. The more you make love, the more you increase your opportunity of becoming pregnant. I love that question. Okay, so please keep asking your questions. This is an opportunity to ask your questions in real time and understand the mechanism behind pregnancy. Now, there are some odd pregnancies. There are some pregnancies that will blow your mind away. There are some inexplicable pregnancies that you don't even know how it happened. Like a woman can become pregnant with one guy's baby and become pregnant again. So a woman can practically be carrying 2 babies in her womb who are not twins. They got fertilized by 2 different men. It happens. It's rare, but it can happen. So there are so many forms of pregnancies that can happen out there that might not be normal. Okay, what can BFB couple? Remember, in our group, BFB stands for believing for babies. So we don't try, we believe. We are faith believers. So what can BF couples do from now on to increase their chance of conception before 2022? I have a good news. Today it's the 26th of October, 2021. So if today is 26th and we have 30 days in October, you have approximately less than about 6 days to end October, right? Now, November is 30 days. December is 31 days. So you have 61 days. Now, if you add it to, let's just give you extra 10 days. You have approximately less than 70 days to get pregnant. So what can you do? Number one, you have to re-energize your praying pattern. You have to pray. You have to believe in your prayer. Then you have to pray effectively. People pray the wrong way. People keep asking God the things they've been asking God without knowing that God has answered that. So number one thing you can do before the year ends to make sure you join our crossover clinic. So on the 31st of December, please, I know you'll be going to crossover service and all that. Give us just 1 hour. We are going to run a clinic. We are going to enter 2022 with all our babies, with all our testimonies. Now, when you have said your prayers, you have to activate the second P, which is playing. Playing means every 48 hours. So if you made love today being Tuesday, you can have a break on Wednesday. You can continue on Thursday, break on Friday, continue on Saturday. Every 48 hours. Come rain, come shine, good, bad, the days you feel good, the days you don't feel good, it doesn't matter. Make love with your partner. That's number 2 point. Number 3 point, practice. Know your age. Know your chances. Unfortunately, every woman is going to age. So if you are currently 35 in our group and you have been praying from Genesis to Revelation and it's October and you're not pregnant, prayer is not a problem. The problem might be the other two P's. So activate your 2 P's. Now, if you're 35 and below, you still have 12 months, right? So the tiebreaker is 35. The reason is because your chances dwindle the older you get. So if you can pray, if you can make love to your partner, then if you can go for practice. So practice means everything I've been teaching you guys since 2015, you're putting it into practice. When you've done your best, if it's not working, you go to the next step. Like if you followed my channel, if you followed my timeline, I had beautiful testimonies today. Imagine a lady that had 10 miscarriages, 2 ectopic pregnancies, and she still succeeded in becoming pregnant. Imagine a lady that had 10 failed IVFs and she just have to take her bold step. She went for 2 surrogacy, fertility treatment. Fortunately, the 2 candidates are going to have twins. So suddenly from no baby to 4 babies. That's what I call faith in action. So if you want to become pregnant before 2021 ends, pray, play, practice, and name your babies. I normally challenge my community. If you can name your babies, if you can see your miracles, you can have them. But don't just show up every day and you're not doing nothing and you're expecting miracles. All the testimonies you see in our group are people that took their chances. So I want to encourage you to take your chances, okay? All right, let's see. How can women with PCOS and women with irregular periods track fertility? Now, you have to do your own part. Then you have to allow the fertility specialist and the gynecologist do their own part. So if you have confirmed polycystic ovarian syndrome is a known factor that can cause female infertility. Why? Just a simpler reason of disrupting your whole cycle. So women that have polycystic ovarian syndrome, one of the major effects of polycystic ovarian syndrome is the inability to ovulate. Why? Because in those women, they will produce more androgens. These are the male hormones, which will stop you from ovulating. And by default, if you can't release egg, you can become pregnant. So women that have PCOS might have problem tracking their period, but you still have to make sure you log in when you're bleeding, when you're having this in your app, or you get a calendar for that. Do it by yourself. Then you need to see a fertility specialist. Now, when you see a fertility specialist and we confirm you have PCOS, there are some medical treatments we can give you, but you have to go home and modify your own lifestyle. So you have to make sure you work on your body weight, you work on your stress, you drink a lot of water, you avoid alcohol, you avoid smoking. If you can do this, your fertility specialist can help you to track your cycle. And while you're doing this, you keep on praying, you keep on meeting with your partner, and you increase your chance. So regardless of your diagnosis, no matter how long you've been having infertility problem, it doesn't matter. You can suddenly become pregnant. So long as you're living, God can make you pregnant at age 50. God has done it before. God can multiply one egg into so many. God has done it before. So it doesn't matter the number of years. Just wake up every day, energize yourself, encourage yourself, pray, play, practice. Okay, so that's what you need to do. When you have done your best, you need a fertility specialist. Does regular periods mean that a woman is fertile? No. It doesn't mean you're fertile when you're having regular periods, but it means the probability you are fertile is there. There are some women that will not bleed, but they can become pregnant. The common denominator in becoming pregnant is ovulating. So there are some women, for some reasons, they are not bleeding outside, they are bleeding inside, but they have ovulated. Or for some reason, your body is still struggling with so many things, but you have ovulated, you can become pregnant. So some women can be bleeding every month, normal, everything is okay, but they are having foundational problems with their cycle. So don't be deceived. This is the reason why some women are interested in seeing their bleeding. You know, there are some women that will subscribe when you ask them, they are presenting complaint. Doc, I have not been seeing my bleeding. I want you to give me a drug that will make me to bleed. So people want to see before they can practice. So the fact you're not bleeding today doesn't mean you don't have ability to become pregnant. You can suddenly become pregnant. There are some women that are new mothers. They haven't started bleeding. They are not breastfeeding their baby, or they are breastfeeding their baby and combining with, formula method. You can become pregnant. Some women can quickly become pregnant within 1 week of having a miscarriage or stillbirth. Some women can quickly become pregnant before their period returns. So whether you're bleeding or not bleeding, whether it's irregular or regular, if you want to become pregnant, keep on making love. It doesn't matter. Okay? Is it possible to get pregnant before period? Now, remember, in medical practice, there is no never, there is no always. Now, we are going to talk about probabilities. Can you become pregnant before your period? Yes. What is the probability? Very tiny. Why? Because by the time you're getting towards your period, the eggs that got released is already disintegrated. Remember that your eggs can only last for 48 hours. So what leads to breakdown of your cover of your womb? Pregnancy didn't happen. So the body is kind of going all over the place. So the possibility of becoming pregnant before your period is there, but it's very, very limited. You have a better chance of becoming pregnant shortly after your bleeding or some days after your bleeding. So the farther away you are from the time you've ovulated, the more the likelihood it will be difficult. So it will be more difficult for a woman to become pregnant just a little bit before her period, because by that time, everything is already broken down. So before your period is actually one of the safe periods to make love in women that can comfortably predict their cycle. So the possibility, the probability, and the chance of becoming pregnant is there, but it's very, very limited. The best chance for a woman to become pregnant is within the fertility window. Okay? All right, guys, we have 2 more minutes. 2 more minutes to wrap it up to 30 minutes. So if you have any question further, feel free to ask. Hopefully on Saturday, we get another topic and we have to broaden our horizon and we keep learning. Now, remember, we have a big event this coming Sunday. You do not want to miss this. This is actually the first time we're having a combined seminar. So we're going to have a program for women that will become pregnant and become mothers in 2022. Then we are also going to have a program for women that are currently pregnant. So there are a couple of things you need to be conversant with. You see, it's very easy to forget how difficult it was for you to become pregnant. So many women become pregnant, they vanish. Some of them will not even come back to share the good news with us. There are, like in our group, We know thousands of women are becoming pregnant using PPP method. There are so many women that are just becoming pregnant. Some of them, you see their babies in Facebook, in Instagram. They didn't come to tell you, oh, doc, I'm pregnant now. Thank God with me. Or maybe when they start having problems, they come back. So it doesn't matter. Just go home. Practice what we preach. Practice what we teach you. We love your babies. We want to celebrate your babies on our platform. So thank you for coming this afternoon, this evening, this night, depending on where you reside. We appreciate you, and show up on Saturday for another episode of Open Clinic with Dr. Chude Ufondo. Thank you, and God bless you, and bye-bye for now.